Matt is a 15-year-old Caucasian middle-class male. He presents with symptoms of anxiety and depression. He states that he has been depressed for about 6 months and that he feels dead inside and that there is nothing but depression, sadness, anger, and rage. He reports feeling hopeless and helpless. He states that his symptoms were precipitated by the rejection of a female object of his affections. He says that he thinks about the situation constantly and that the symptoms interfere with other daily activities, including sleeping, eating, and schoolwork. He displays evidence of low self-esteem and self-worth, stating that he doesn't even care for himself. He admits to at times drinking too much alcohol and says that it alters him. He goes on to refer to himself as schizophrenic and worries that he may do something stupid. The client states that he lacks optimism, confidence, and the ability to change. Matt describes growing up in a household which includes his mother, father, and older brother. He says that he feels his family does not love him and that they look down on him and think that he's not perfect enough. He claims his friends nor anyone else actually care about him. He reports social isolation throughout adolescence and says that he has never had a romantic relationship. He finds it safer to be by himself, and as a result, he lacks important social skills. He has a history of negative thoughts and beliefs about himself, his life, and his future, which were exacerbated by the situation with the female. His presenting problems appear to be a consequence of his faulty cognitions and core beliefs. These core beliefs include feeling worthless, inadequate, and being unloved and unlovable. His automatic thoughts include things are not going to get better, no one cares, and that he is nothing without her. His intermediate beliefs include feeling that if he had a relationship with this female, then he would not feel empty and depressed. Behaviorally, he seems to have limited self-regulation and relational and social skills. Treatment goals include reducing depression and anxiety symptoms, improving self-esteem, social skills, and increasing daily functioning. Treatment focus is to look at the negative situations in his life that are caused by or made worse by his maladaptive beliefs and behaviors. Treatment strategy will be to use CBT therapy to examine the relationship between his experiences, thoughts, and emotions. This will help him to identify and replace his maladaptive thoughts and behaviors with more adaptive, effective ones. CBT interventions will include identifying cognitive distortions, thought stopping, replacement, Socratic questioning, examining the evidence, cognitive restructuring, exposure, and skills training. Homework will include activity scheduling and using a data log and automatic thought record to examine and replace maladaptive cognitions. Initially, the client will have individual therapy and eventually enter psychoeducational group therapy. Possible aids to treatment include his above average intellect and cognitive abilities, his desire to talk about his condition, high potential for insight and persistence. The possible barriers to treatment include continued excessive use of alcohol and avoidance or resistance of treatment. If and when a therapeutic relationship is achieved, the client may cling to the counselor, thus making termination difficult.